For some reason, massive doofus Howard Schultz was given a town hall by CNN. I don't know why they're doing that. Like, why not give a town hall to, Tulsi Gabbard? They gave one to Kamala Harris. That one was obvious. I mean, Time Warner is a big donor of Kamala Harris, the top donor, in fact, of Kamala Harris. So that one was obvious. The mainstream media has been, just sucking her off this entire time. So Howard Schultz was doing a town hall, and it's going to be very clear he has no clue what he's talking about or what his plans are. Go ahead and check this out.
So I'm wondering, what is your view on Medicare for all? More specifically, what is your plan to improve our healthcare system?
Again, thank you for the question, and I think this gives me another opportunity to talk about the extreme left and the extreme right. And so we have a healthcare crisis in the country on many levels, not the least of which is the opioid crisis. But the Republicans, for 10 years, 8 years during the Obama presidency and the last 2 years, have done everything possible to eradicate the Affordable Care Act. And they've done that without offering any plan. This is the far right. The far left is now suggesting Medicare for all. That is a $32 trillion number. And just like the issue I brought up before about making all the buildings in America energy free in terms of clean energy, does anyone here really understand that Medicare for all also means that you will lose the choice of your doctor and your private insurance company? Not many people know that. So that would disrupt the entire system, and it'll cost $32 trillion.
So, Mr. Schultz, to that question, and because your question, Rio, was about what's your plan, and many, I think, wonder, is it fair to criticize the left and the right? What is your plan to make sure that if it's not Medicare for all, what is your plan to make sure that every American can get quality, affordable health care?
First and foremost, three principles. One, I think everyone in America, every person deserves to have the right for affordable care. Every person. Second, there needs to be competition in the system. And what I mean by that is competition so that the American people can get access to prescription drugs at lower prices, because right now the government is not allowed under a federal law to negotiate with pharma. The third thing is that it has been tested but not proven yet about interstate commerce among insurance companies. But there's no doubt that, once again, the healthcare crisis has been with us for a long time. The other issue is I stand by the fact that I supported the Affordable Care Act. It covered 20 million people who did not have good insurance, but premiums have gone up double since the Affordable Care Act. So now we got to go back in and fix the Affordable Care Act and bring premiums down. Competition will do that. But the far right, remove the...
How? The question is how.
Yeah.
I don't mean to startle you from the back.
No.
The voice over your shoulder over here. But how specifically? Because I think so many people here hear that, but they say that is what Congress has been trying to do or talking about doing
You're wrong.
for so long.
Respectfully, it's not what Congress has been trying to do. What Congress has tried to do is, on the far right, eradicate the Affordable Care Act, and now on the far left, bring up Medicare for all, while prices have gone up. I mean, people are paying $300 for a vial for insulin that 10 years ago cost like less than $100, and the cost of it hasn't gone up. So this, you're gonna
But lowering the price of prescription drugs doesn't solve the whole problem.
It doesn't solve the whole problem, but do we understand the fact that the prescription drugs, again, I don't know how many people understand this. Prescription drugs in America are priced at price X, because we cannot negotiate with the drug companies. Those same drugs that are manufactured here are available in other countries at a lower price, because the drug companies and the insurance companies are spending $400 to $500 million a year in lobbying efforts in which both parties are complicit to maintain the status quo.
Yeah, so that answer was truly embarrassing. I honestly couldn't believe that answer. I mean, how weird of a weird mixed bag could you possibly be? Do you see what I'm saying? Like, he somehow says so much shit in there that there's no central planning whatsoever. So first of all, saying that we can't have Medicare for all, bullshit, fuck you. We can't have Medicare for all. You're a smug billionaire D-bag who nobody cares about. And it's increasingly clear that this guy's a massive narcissist because he doesn't have any answers for any of this shit. But this guy's such a narcissist billionaire, it's all about him. It's all about Howard Schultz. Okay, everything is about Howard Schultz. It doesn't matter the means or, any of his positions and shit like that. It's irrelevant. So, he says the far right was trying to repeal the Affordable Care Act. No, dude. All of them wanted to repeal Obamacare. Remember, repeal and replace was by Mitt Romney. That was his campaign promise. That was his campaign. That's what he ran his campaign on. But all of that time, they had nothing to replace it with. Repealing the Affordable Care Act was not a far-right position. It ended up being a lot of the Freedom Caucus members they ended up fighting the Republicans because the Republicans were trying to do a compromise repeal, but it was the position to replace with something that they had no clue. So that was the right-wing position, not the far-right-wing position. It ended up being that, Freedom Caucus ended up fighting with a lot of the mainstream Republicans because the mainstream Republicans had to compromise on how much they were going to repeal Obamacare because of public polling and opinion data. So that one honestly didn't really make any sense. So he awkwardly does make a good point about the prescription drugs. We should be able to, we should actually be able to speak to and negotiate with the pharmaceutical industry. I believe that that's what Canada does. And they have, I believe, they pay 2 or 3 times less than we do for our prescription drugs. And this is actually a good solution. I do agree with this one. I think Bernie Sanders' solution, which Cory D-Bag Booker didn't vote for, this amendment, was we would allow drugs from other countries to be imported here like Canada because they're a lot cheaper. But definitely negotiating with them would absolutely be a good idea. Definitely agree with that. And so this is what I mean by there's so much shit all over the place. And then he talks about Obamacare and he praises Obamacare, but then he shits on it. So I don't understand. I don't understand that either. So you say, you love Obamacare, you support it, you want to keep it in place and everything, but then you just pivot to just straight shitting on it. So which one is it? Do you really like Obamacare? Is that your favored form of healthcare? Or do you want to alter it? Because I'm honestly, genuinely very confused. Which one is it? Do you like Obamacare? Is that your preferred plan? Or do you not like Obamacare? And then we get hit with this shitty competition argument that has been, just ad nauseum by the Republicans for the longest time. And I actually wrote an article about this, which was that this talking point that we need competition across state lines to drive down the premium prices. By the way, he brings up the premium prices. Healthcare costs are a problem, but they're not, a lot of this has to do with Trumpian things that he's done where he was reducing the subsidies so that made it so that healthcare insurers were able to make sure to insure their low income insurers. I'm forgetting what they were specifically called, but it basically was exploding what was going on, and so middle class people would then take the fall for that, and because they wouldn't be eligible for those subsidies, and they would have to accommodate for the low income insurers. So he's done a lot of that, but under Obamacare, the premium talking point is certainly one that's been used a lot. But if you look at the top rises, most of those states are ones that rejected the Medicaid expansion. But B, not only that, but it's not as if they're paying all of them are paying those premium increase numbers, because those are all pre-subsidy numbers. So obviously healthcare is a huge problem, but the idea that Obamacare fucked it up instead of making it better is really fucking stupid. And also with the single payer thing, this is remember, I forgot if it was Warren Buffett or Bill Gates or both who said that we need a single payer system to control the costs. So that's honestly seems like to be the billionaire perspective, but I guess for this D-bag, that's not really his position. But this guy is clearly, and why do you not have an answer? If you ask Bernie Sanders, yo dog, what's your healthcare plan? He'll be like, yo, dog, I got you. Medicare for all, you know, to abolish all the current private insurance plans. You can get private supplemental insurance if you want. Everyone is covered by Medicare, just like is under law right now. You can't, you know, have private insurance that duplicates Medicare, so you can get supplemental care. You know, we're going to negotiate with the pharmaceutical industry and just blah, blah, blah. All this stuff, right? He's got a fucking bill after bill that he's proposed on those shits. So if you're going to run for president of the United States, you need to be ready for what was voted on. I believe this was voted on most recently as the most important issue to voters, healthcare. Healthcare, it's extremely expensive right now. We've got a broken system that has been a result of many problems, but having your half-ass bullshit, and is anybody amused by this? Who the fuck looks at this and goes, I support that guy? Because in that entire, you know, Cajun jambalaya of a fucking, you know, answer, he says, I want to negotiate with drug companies. That's a great position. Obamacare is good. I wouldn't repeal it, and I supported it, but we need to have premiums go down, so I want to alter the law. So it's like, which one is it? And also another thing about that, there's actually a provision inside of Obamacare that would allow two states to come together and say, okay, we can have it across state lines. Nobody talks about that. There's actually a provision in there. It says two states want to come together, they can do that to have it across state lines. And also the obvious problem with that is all the insurance companies are just going to go to the state with the least regulations. And that's an obvious point. I don't even need to make that one. But this is just a clear, like, mumbo-jumbo fucking garbage in there. And he has no clue, no clue what he's talking about. He's just a plutocratic narcissist. His entire being in terms of politics is, I'm a billionaire. My power is essentially derived from my insane, massive wealth. Listen to me. That's what he's doing.